You're gonna have to click through.
Hi, my name is Josh Hong, and today I'm going to be reviewing my critical assignment for KIN 353 for care and prevention of athletic injuries for Dr. Garrett. So factors that may cause injury. Indoor versus outdoor courts. Obviously the type of playing surface. Doesn't matter whether it's inside or outside. It's more matters about the physical structure of the court. So there's cement and asphalt, which is hard, grass, which is very soft, and clay, which is also soft. So weather does affect playing conditions. So rain and wind can affect how you play, whether you play inside or outside. Obviously extreme heat too, because if it's too hot, you might have to sit out. So some different things with gender in regards to men and women's sports is men sometimes have more strength with hitting the ball. Women maybe have better technique. Also, biomechanical considerations in regards to gender with their inherited traits is women tend to not be able to flex as much as the hip and knees, so they're more prone to ACL injuries. And also the age, whether younger or older, can make it more likely for sports injuries to happen. And then beginner versus advanced. Obviously advanced and professional people know what they're doing more, and beginners are more likely to hurt themselves. Lateral epicondylitis and epicondylosis, so tennis elbow, referred to as tennis elbow, diagnosed and treated as an inflammation historically, and epicondylosis correctly describes the degenerative condition involved of the wrist extensors, tendons, lateral epicondyle, particularly extensor carpi radialis brevis, and pronator teres muscle activity, in 2019. And then obviously with this, repetitive microtrauma often and overuse and forced rehab are extending the risk. According to Prentice 2020, basically means that if you overuse it, you can damage the muscle and cause cracking in it, causing tennis elbow. It also is seen in other sports such as racquetball, golf, or other occupations with repetitive movements. So maybe like manufacturing or something. So some of the MOIs of the lateral epicondylitis and epicondylosis are associated with faulty stroke mechanisms, mainly the backhand. Debate exists whether it's safe to use one or both hands for the backhand stroke, minimize or prevent injury. So less experienced players transmit more shock impact on the elbow joint. It makes sense because they don't know how to properly hit the ball as well as maybe someone who is more experienced, according to Whiting, 2019. So this is just a continuation. Tightness and grip size and strength. String tension, often with ball contact, which is huge. Racket vibration, according to Whiting, 2019. Lateral epicondylosis assessment and testing. Okay. So the elbow needs to be flexed at a 45, so that's half a 90-degree angle. And the clinician resist hand or wrist extension and flexion. And here's a picture of the test. The clinician has a hand on the wrist and a hand on the elbow. So the methods for Mills testing are to palpate the lateral epicondyle and stretch the extensors in a passive manner by pronating the forearm, and flexing the wrist fully. Uses one-handed backhand. Layton uses two-handed backhand. Epicondylitis treatment. So rest, ice, compression, and elevation. Ice is used 20 minutes, every 20-minute session for 4 hours. Compression involves use of an elastic bandage to decrease swelling. Elastic bandage should fit snug but not tight. Elevate the elbow above the heart level to allow gravity to move fluids away from the injured area. Some things that are important are non-steroidal anti-inflammatory drugs such as ibuprofen to reduce pain and decrease swelling and inflammation. Preventative exercises are compound joint exercises performed at the pre-injury for strength or skill. Overhead press with 2 dumbbell weights. 3, and then the progression, you want to do overhead to a seated row, and low pulley, bent over lateral raises. So you're just literally like hunched over or bent over with your back straight, and you're pulling weight laterally on a machine. And then here's the progression from a low pulley to a lat pull down, and here's a link. So some rehabilitative exercises are wrist extensions with dumbbells. So if you can see my wrist doing this, hold the dumbbell with the palm facing up and support the elbow on the thigh. And the progression of this exercise is a wrist extension with the dumbbell pronated and supinated in the dumbbell. So for the low pulley bent lateral raises, this is a good one. Obviously you're bent over and you're pulling laterally the exercise machine. And here's the video down here. So tendon rupture of the Achilles involves splitting, tearing, and separating fibers. So the Achilles tendon rupture of the MOI, mechanism of injury, so it results in a pushing off action of the forefoot where the knee is being forced into a complete flexion, according to Prentice. You can see it right here. An example of this would be an athlete reaches for a ball and loses his center of balance. The rupture of the MOI is continued. This can occur in tennis during a serve. The player tosses the ball high in the air and forcefully drives it overhead towards the opponent's side. For example, he or she can come down with so much force they can rupture their Achilles tendon, according to Whiting, 2019. So one surefire way to test the Achilles tendon rupture is called Thompson's test. Patient lies prone, examining with the feet hanging over the edge. The clinician squeezes the calf muscle while the leg is extended and visually checks to see if the foot plantar flexes. Positive test is one which squeezing the calf muscle does not cause the heel to move or pull upward. Here's a link below. So the tendon rupture treatment for the Achilles rupture involves surgery or repair, usually not fun. Some things you can do that are not surgical are the Pulleys, obviously, and the NSAID. Talk to your doctor before taking any drugs in regards to that. Placement of non-weight bearing cast for 6 weeks, and then graduating to half or short leg walk cast. Exercise rehabilitation prescribed approximately 6 months, consisting of ROM exercises, range of motion, heel lift placed and worn in both shoes, according to Prentice, 2020. So for the rupture preventative exercises, compound joint exercises, you would want to do 3. Exercises prescribed either by strength or hypertrophy. So if you go to a barbell back squat, you would want to transition to a deadlift. And if you're doing good morning, you would want to transition to a lateral lunge. And here's the links below. So the Achilles tendon rupture, rehabilitative exercises. It's a single joint exercise performed post-injury after the fact you get injured. Exercises are prescribed for either endurance or hypertrophy. The goal is return to the injured player to sport of tennis, standing calf raises, that's important, and you want to transition to a lateral leg lift from there, and a seated flex toe flex with resistance band, which is a good excellent exercise. And then you want to go from that seated toe flex with resistance band to an ABCs of the foot. Yeah, there's a video, and here's a picture of a machine you could use. So here's the last topic, the ACL. It's the anterior, so it's front cruciate ligament between the femur and the tibia, which is like your front leg. So it's obviously one of the most common, or most seen, you should say, most common injuries of the knee, stretching and tearing. Can also happen in the medial collateral ligament along with the posterior, which is the back, and lateral collateral ligament. Yeah, so it's dangerous and you want to be careful. The anterior cruciate ligament, the MOI, this is a famous tennis player, and as you can see, he's not happy because he just tore something. The mechanism of injury often involves a non-contact rotary force associated with cutting, planting, and landing in valgus position. The ACL tear may be interrupted in hyperextension and mechanisms of injury, or single force contracting of the quadriceps and pulls the tibia forward on the femur. Research shows that ACL tears are more common in women than men, and I believe this is due to the fact that women tend to not have as much flexion in the hips, and yeah. Anterior cruciate ligament tear, mechanism of injuries continued. So the hyperextension of the foot, hyperextension with a force of the front knee with the foot planted. A patient with a torn ACL will often hear and feel a pop, which is followed by immediate disability and pain and rapid swelling. So here's the Lachman's test. Okay, so that's good. And here's some information about it, and here's the video. So anterior cruciate ligament test. Here's the lever sign test, which is pretty simple. It's acting as a lever, pushing down on the leg with the fist below the calf muscle, and if it moves up, that means the ACL is torn. Oh, and there was my video link below. And so some really important things to do to help calm it down once it happens. There's something called the Pulley method, which is protecting it, optimal loading it, obviously ice, putting an ice pack or something like that, something cold, bag of peas, and compressing it, so some kind of compression pad or something, or band, and then elevation. Electrical stimulation can also greatly help. An ultrasound, according to Practice 2020, is sometimes good to help blood flow. Anterior cruciate ligament tear. So preventive exercises are wall slides. And from wall slides, you can go to a plyometric depth jump off a box, and then step up onto a raised box progression. Step up onto a raised box to jumping jacks. Here's a video link. So the anterior cruciate ligament rehabilitative exercise are straight leg raises in supine position and single leg Romanian deadlifts. So from the single leg, you would move to a manual resistance clamshell, and from the straight leg raises in a supine position to a standing lateral leg lift. And here's a video below, and here are my references. Thank you. Have a good day.